Focusing on the bladder on this CT of the abdomen and pelvis that was performed with contrast, we can see that the bladder wall may appear thickened in this particular case. If you actually measure the wall here, and we measure it from here to here, it's measuring probably around 7 millimeters in thickness. And so the question then becomes, well, is that a normal thickness or is that an abnormal thickness? And one of the things that was found out was that the more distended the bladder is, the thinner the wall ends up being. And so the more underdistended it is, the thicker the bladder will appear normally. And so there was a study that looked at bladder wall thickness and normal values relative to the actual volume. And so how do you measure the volume? Well, you measure it basically length times width times height. So in this case, it's 6.8 times 6.5. And then if we look at the height here, the height is around 3.4 centimeters. And so the actual total volume for this particular bladder is going to be 78 milliliters when you use that formula. And so the question then becomes, is this 7 millimeters normal in a patient with a 78 milliliter bladder volume? And so here's the paper here. I'm just going to pull it up right here. And you can see in this paper that looked at normal reference values for bladder wall thickness on CT in a healthy patient population in abdominal radiology, you can actually see the reference values over here. And I'm just going to zoom into it so that we can see it more closely. And using the ellipsoid formula, you can see that when the bladder volume is really low, 10 to 19 milliliters, the upper limit of normal is 23 millimeters in size. So in our particular case, where it's 75 to 99 milliliters, the normal thickness is 4 millimeters, and the upper limit of normal is 9 millimeters. So in our particular case here, where it was actually 5 millimeters in thickness, or sorry, 7 millimeters in thickness, that's within the normal values within this particular bladder volume. Now, if the bladder volume was much more distended, you can see that 7 millimeters in thickness is abnormal. It's more than 2 standard deviations when you get into the 150 to 249 milliliter volume of the bladder. But in this particular case here, this should be read as normal. The other thing you look out for to see if there's abnormal bladder wall thickness, if you're thinking in terms of is there inflammation or cystitis, is to look for stranding in the fat surrounding the bladder. And in this particular case, you don't see anything there. So there's nothing to suggest that this particular bladder is abnormal.